My podium presentation was on part of my dissertation work centered on blood flow restricted resistance exercise. So blood flow restricted resistance exercise, or it's commonly known as BFR, is simply taking a blood pressure style device, inflating it around an exercising limb while the individual completes whatever the exercise protocol is. So we looked at the application of BFR in well-resistance trained men and how adding that BFR stimulus might augment or amplify a number of physiology markers. So what we did was we brought in a total of 19 individuals. They had to have squat at least 1.5 times their body weight on a barbell back squat to be included. Once they passed that screening criteria, then we would take them through 3 different protocols. The first was to quantify just the stress response with the BFR cuff itself and no exercise. So they come in and rest for 10 minutes, sitting passively with just the BFR cuffs on. And then we would take a number of different measures, some salivary measures for stress response, hormonal measures, and then some blood measures, continuous heart rate. We had a little device that measures intramuscular oxygen saturation, and we'd look at a number of these things. Again, that first visit is just passively wearing the cuffs themselves, no exercise. Then they come back in at least 2 days later, and then they would do the same BFR stimuli, so they'd wear the cuff as it was inflated, and they'd do 4 sets of seated leg extensions, all sets to failure with a minute of rest in between, and we take the same measures. And then the final visit, they would come back in, do the same volume of resistance exercise, so the same repetitions, same load, etc. But now the only difference is we're taking those BFR cuffs off to see how much adding those cuffs amplifies the effects of the exercise stimulus. So the measures we looked at were 2 things in saliva. One is salivary cortisol, and the second is an enzyme called alpha amylase, which is a surrogate for adrenaline and noradrenaline, or these fight or flight measures. We also look at blood lactate, which is a metabolic factor, which is commonplace in BFR. A lot of people talk about BFR and the muscle pump and this metabolic drive, etc. So we quantified that in addition to some other factors. What we saw, as we expected, was that adding that BFR stimulus to the 4 sets to failure did significantly amplify those stress markers, and it significantly elevated the blood lactate concentrations of those exercising individuals in comparison to not wearing the cuffs and doing the same volume of work and just passively sitting in a leg extension machine with the cuffs on and not doing any exercise. So we're confident in that applying those cuffs does elicit an amplified exercise response. So we're excited to dive into some deeper mechanisms later on and follow-up work that we're doing now. So this unique exercise modality, BFR, it's a tool that is becoming more popular, at least in research settings. It's getting more traction in terms of scientific inquiry. There's more and more publications every year coming out on this method, but not a lot of work has been done on genuinely well resistance trained individuals or even athletic populations. So my aim was to dive into this intellectually interesting concept of occluding the venous blood return in a muscle while they're exercising to see how it does augment their exercising physiology, to better vet whether or not it may even be of use in a normal training regimen or not. Does it offer additive benefits that doing training without the cuffs on might otherwise not give these athletes? Could it be supplemental in nature? And just looking at some of those questions in greater depth. My poster presentation at NSCA was on using a piece of technology called near-infrared spectroscopy, which is just a fancy technical name for a device that measures the muscle oxygen saturation within the microcapillaries in skeletal muscle during exercise or even passively during rest. So it's this little sensor that you'll tape onto the outer sweep of an athlete's quadriceps. And in this project, we taped it on the outer sweep of some rowing athletes from here at KU and measured their muscle oxygen saturation throughout a graded exercise test, which is just a test on the rowing ergometer that gradually increases in wattage up into a 7th step, which is max all out for 4 minutes. And we'll measure that muscle oxygen saturation throughout that GXT to dial in on different training zones for exercise prescription or some other factors as well. So for this project specifically, we looked at a variable called SMO2, or muscle oxygen saturation resaturation rates. So while an athlete is exercising, you'll see that oxygen saturation percentage decrease a little bit as the intensity gets higher and higher. But in between every bout of exercise, once the athlete rests for about a minute, you'll see that SMO2 value rebound up, and that's a resaturation rate, or loosely recovery rate. And we looked at that throughout that entire graded exercise test to see how that resaturation rate at the level of the muscle increases in response to increases in intensity. We also looked at it longitudinally to see how their recovery rates during dynamic exercise may have improved over time as a monitoring tool or maybe a performance proxy. So a lot of those ideas came from an application in science called a vascular occlusion test, where an athlete or an individual will come in, they'll inflate a blood pressure cuff around their leg with that device on until there's no blood flow coming in, and then they'll let go of that blood pressure device really quickly, releasing all that trapped blood, and see how quickly that SMO2 variable rebounds up. And that's a recovery metric, so to speak, as well. But we wanted to look at that in a dynamic sense with athletes during activity, which is what we looked at in this study. So we saw that SMO2 resaturation rates do increase or get faster and faster in response to increases in wattage. So as it gets harder, their recovery demands increase as well. And we preliminarily saw that if you take the average recovery rate across the entire test and look at it at different time points throughout the season, that it may also coincide with increases in performance throughout the season. So it may be one additional proxy for progress over time in athletes as well.